Welcome back, everybody. We continue on Miller and Brinson. It's always a treat, and I mean that seriously, when the sleep doc is here, because he never puts us to sleep.
No, he doesn't, and I think probably the fact that he promised to take us to Glen Oaks is maybe...
I think that's even better.
You think? Absolutely.
I think that's the reason, yeah.
Dr. Stephen Grant is here. iowasleep.com is the website. Hi, Doc. Good to see you.
Yeah.
Good to see you guys.
National Sleep Awareness Week is underway. It starts today. What does your industry want to accomplish in this week as far as spreading what message?
I think the recognition of something that doesn't get a lot of attention. My impression is that sleep is put on an order of priority that's not consistent with good health a lot of times. I see people cutting corners on when they go to bed, how much sleep they get. And it's a wiggle point in a very busy schedule that can have some profound implications for people, from just mental health functioning to physical health and safety. And so part of the point of National Sleep Awareness Week is to draw attention to the fact that we need sleep. Sleep plays a vital and important role for our bodies, for our mental health. And I think that it's an opportunity to start a discussion.
When you talk about starting that discussion, and I'm a person who struggles at times to get sleep, got nasal issues, and probably it's allergies on several occasions. But with that being said, during Sleep Week, is there something that you yourself could give information about, instead of somebody going and have their nose prodded and maybe having a surgery when maybe they don't need a surgery? Or is there some way to get around that that your expertise could help people?
Sure. I think there's a lot of misconceptions about what sleep disorders are and what we do. Sometimes even within the own medical community, we're not just in the business of doing sleep studies and putting people on CPAP machines, or the nasal masks as they call them. We're a full-service practice. We do a fair amount of insomnias, sleep behavior-related issues, whether it's restless leg, people with nightmare disorders. We see the full spectrum of people that come in saying, I'm having problems with my sleep and I would like some help.
I've been getting, I don't know if it's age, I get cramps in my legs at night. And I don't know if that's a sleep disorder, if it's a sleep interruption. I don't know what it is, but it's quite bothersome. And it seems to have, as I've gotten older here, I get them more often.
Okay, young guy like you, I would probably...
He's such a good liar.
I would probably say that there's a point of engagement about your sleep that you just brought up, that every now and then my legs hurt and I feel like my sleep is clearly affected by it. The question becomes, is that a conversation that you have with your regular primary care doctor, or is that something that you'd like to speak to a specific sleep specialist about? And our opinion is, we don't demand that you have or require that you need a referral to come speak to us. But a lot of patients will almost say, hey, I should probably talk to my regular doctor about this. And at times they might not get the answer that they want. Your doctor may say, hey, you have this issue, take this medication. Plus, minus, it works. You might not feel like you have a lot of options to re-engage the topic with your physician. People use us for second opinions, but
they don't need to.
They don't. Yeah,
right. Because the referral, the fact that you don't need one, and we've talked about this before. People shouldn't worry, in most cases, about insurance not covering a trip to see you.
Correct. I think that there's this perception of, surely this is something I need a referral for, or that this won't be covered by my insurance company, and that's just not true.
Can I go back to the mask thing one more time?
Sure.
Because, as I said, I'm all stuffed up. Can't seem to clear it. So is that an issue that if somebody was had a similar problem, do they come see you? Can you, with your expertise, advise them with what is wrong, or do they need to go see eye, ears, nose, and throat guy before they come see you?
Yeah. Well, I work collaboratively with some ENT physicians here in town, as well as with some dental specialists. There's a lot of ways to treat obstructive sleep apnea. It's not just about CPAP machines. That's the nasal mask that people wear to sleep at night. And I feel that more often than not, people feel like a barrier to getting diagnosed is the conception that treatment will always include perhaps wearing the nasal mask, and that's just not reality. There are a fair number of patients that with just mild to moderate obstructive sleep apnea can have other very clear less invasive interventions that work well for them.
We're about to spring forward here. I think this is our last week, and then this coming weekend we spring forward time-wise. What does that do to us as we move our body clocks forward?
I think we've talked about this a
yep.
couple of times. It's the type of thing where you might want to creep up on the target a bit. In other words, an expectation of the clock jumping ahead. You might want to take a look at increasing, or really more accurately, decreasing the time to bed. So if you're going to bed at 11 o'clock, maybe for a day or two start going at 10:45, then another couple of days 10:30, then another couple of days 10:15, then 10 o'clock. Boom, when the time change happens, you're right back on schedule again and not suffering with some perhaps anxiety of sitting there at midnight going, I'm not quite tired yet, or I'm not ready to go.
That happens to me every time we flip the clocks. It does.
Does it?
Yeah, constantly. Yeah, I never. You know me. I never plan in advance.
The moral of the story is creep up on it. I mean, just
okay.
give yourself a 15-minute jump over 7 to 10 days, and that way, when it happens, you're good to go.
Okay. All right.
The website is iowasleep.com. Lots of information on there, Doc. I mean, you've been on there.
Absolutely. We've got a very informative website. There's sections on videos that go over a lot of what we do, who we are, what our general approach is, and we welcome email inquiries. You can contact the clinic through email, set up an appointment. We do a lot online.
Yeah, and the good part is no referral necessary.
That's the
in
best
most
part,
cases.
you bet.
Absolutely. Doc, great to see you again. Don't be a stranger, all
Yeah.
right?
I won't.
Golf course. You and me, Doc.
Yes.
Okay.
Yeah. That's going to do it for this segment. Back with more Miller and Brinson coming up. Des Moines Sports Station, 1460 KXNO.